I think we all know that nowhere is the failure of our healthcare system more apparent than in the vast racial and socioeconomic disparities that we see. And you see this across different measures of health outcomes, life expectancy. Here in LA, there are some neighborhoods, for example, on the west side, that life expectancy is 86, 87 years old. And there are neighborhoods in South LA where life expectancy is 74, 75, a margin of greater than 10 years, right? So, and we see this play out across different measures of health outcomes. So the question is, what are some of the ways that CalCare will help to close the racial health gap? And at the same time, what are some of the social determinants of health that we also need to address in tandem with that, with CalCare? Assemblymember Santiago, do you want to take this one off?
And I want to thank you very much again for the question. And I think what's important to understand is we just went through one of the worst crises of the pandemic. Now, we didn't need that to highlight the fact that our communities have been left behind when we talk about healthcare. In our communities that we represent, and I'll speak for the community that I represent, when you have a great portion of people who are struggling, and I said this before, to pay rent, their jobs aren't tied to good healthcare coverage. When you have populations that are undocumented, like the ones I represent, in many cases they can't get healthcare. Now, we've supported the state legislature, and my colleague has pointed out, rightfully so, healthcare for undocumented immigrants. But it's still a challenge to get them healthcare, and if you don't qualify for that healthcare by income, you're not going to get it. One of the things that we saw during the pandemic, and why it's more important today than ever to get CalCare done, is that we saw our communities who have been left behind historically for a number of reasons pointed out, get left behind in the current healthcare system. And some of these communities have not recovered. We've seen the highest COVID rates in our area. We've also seen the highest death rates from COVID in our area. And we haven't seen some of the jobs come back. And let alone good paying jobs that have been given healthcare coverage. So for me, and for many of us who have been champions on this, getting healthcare coverage today is more important than ever, particularly for communities that have been underrepresented. One of the things that I think is important to also understand is the job's not done there. But there's other work that has to be done to mitigate healthcare emergency. The ability to have good parks. The ability to fight to make sure that there's less pollution in our neighborhoods. To ensure that we have trees. To ensure that when we're talking about big climate change, it's tied to a little climate change in our communities where it's very well needed and we have different approaches at attacking it. But I think this fight in CalCare is directly tied to the larger fights of inequity in our communities, as it relates not just to healthcare coverage, but to an acknowledgement that certain generations and certain peoples have been left behind in this big economic system that is now the large fourth economy in the world. And yet we have a large percentage of people who have been left behind on income, who have been left behind on healthcare coverage, and who have been left behind in other ways. So I think for me, when I take a look at CalCare, yeah, it's a fight. And we gotta fight for it, we gotta make sure that single payer exists in the state of California. But it's also directly tied to the rest of the fights that we've seen across the state as it looks to tackling income inequality. So thank you very much for the question, but I'd like to make that connection. That it's the same communities that we fight for, the same things that we fight for. They're very important. And many in this room also fought with us when we did public banks. And it was the same fight. So I want to make sure that we understand that this CalCare fight is a larger fight that is beyond the state of California, that is beyond healthcare, but it's really about what we envision a California to look like, what it ought to look like, and what it should look like when we start tackling those issues of income inequality. Thank you.
So there was a reason why Dr. King said of all the injustices, inequity in healthcare is the greatest one. There's no doubt there's always been a racial component, certainly a socioeconomic component to injustice in our healthcare system. And the fact that we have healthcare connected to employment further solidifies that, cements that. Because we know that our employment has biases. And so the better job you have, the better healthcare you're gonna have, right? And so if we dig even deeper, if we look at the pandemic, during just the full first year of the pandemic, life expectancy went down for Black Americans 2.7 years, for Latinos 1.9 years. Higher by far than any other groups. And some might say, well, maybe it's because they had more pre-existing conditions, or maybe it's because more of them were part of jobs where they had to go to. It doesn't matter what the reasons are, because the reality is that it's the underlying system that put them in that position, right, of being vulnerable. And so now, coming out of the pandemic, we see covered California rates going to increase by nearly 10% this next year. We see that the state is going to resume checking for Medicare eligibility. It's going to get worse. We've been protected a little bit from some of the pandemic protections that are now going away, and it's going to get a lot worse. And so what does CalCare do to address these inequities? Well, first of all, CalCare will support new ways for vulnerable populations to access healthcare by establishing a special projects budget to fund construction, renovation, and staffing of healthcare facilities in rural or underserved communities. That's groundbreaking. That's something the private sector won't do. They're shutting down these things. They're shutting down during the middle of the pandemic, I was in front of regional hospital in East San Jose when Hospital Corporation of America was shutting down the Women's Health Center. That's the maternity ward, prenatal, neonatal. It didn't matter that I was there or Senator Cortez and I were sending letters to the president, please don't do this. We had no leverage. We had no control over them. They did it anyway. And so with CalCare, we have the opportunity to actually now delve into these issues. CalCare allows for increased payments to doctors and other providers to address the availability and accessibility of healthcare services in rural and underserved areas. Groundbreaking. We can actually pay doctors more if they choose to serve in an underserved community or in a rural community. CalCare prioritizes the funding of special projects that address the health inequities that pervade our healthcare system. It's written in the text of the policy. We're not ignoring it, we're intentionally ensuring that the interests of the patients, of the people, are going to be first and foremost, and there'll be no profit motive in those considerations.
Thank you. You brought up South Los Angeles, so I want to bring up a little history about the social determinants of health that actually are very much impacted because of a lack of healthcare and why CalCare is so important. So up until a few years ago, South Los Angeles actually passed the city council members passed a motion at city council to do a moratorium to stop more liquor stores in South LA, to stop more fast food restaurants in South Los Angeles, and to really bring fresh food to a community that you had a desert for fresh food, very minimal grocery stores. And so what that creates is high obesity, diabetes, hypertension, heart disease in communities where there's already a lack of clinics and a lack of hospitals. It's a community that was largely impacted by the closing of Martin Luther King Hospital, which many folks fight to bring back and reopen, which it did. In my district, we are in the process, we have already lost hospitals. We lost a hospital in Chinatown, which I've represented for the past 6 years, that closed down. St. Vincent's closed down a few years ago. We're potentially in the process of closing down a hospital in East Los Angeles, all of which these communities, South LA and the East Side, share very similar environments when it comes to food deserts and when it comes to just the foods that make people not well. I'm very proud to have introduced Assembly Bill 712. It is a small but mighty bill that's going to make a huge difference for the health and well-being of individuals, which during the pandemic and during the storms and during fires, California gets a federal waiver to allow individuals that have an EBT card to be able to buy fresh, hot foods at a grocery store. Right now, you can use your EBT card and go to a fast food joint, but you can't use that same credit to buy a rotisserie chicken or a fresh salad at a grocery store. You have to buy a frozen chicken, or you have to buy uncooked food. And if you're already a struggling parent trying to feed your kids and your family, you're going to go for something that's fast and easy and convenient. Well, guess what? giving your 10-year-old a fast food meal with a soda every night is not going to be helpful towards their health. So there's a lot of education that needs to take place, but also the realities of how people live. So AB 712, which is a bill that we did twice now, and it was very difficult to get through, would finally allow the California Department of Social Services and Public Health to be able to request a permanent federal waiver from our federal government to be able to ensure that folks on the margins and who receive these benefits are able to provide healthy, fresh, hot food on any given day without a disaster to their families in California. That is critical to ensuring that we are working we're working towards preventative care versus trying to, at the very last minute, somebody ends up at the ER because they don't know that they have diabetes. And what is the impact that has to that individual's financial well-being or their household. So CalCare is part of a more holistic approach on an individual's just ability to live well and live with dignity, while we also try to address all of the other social determinants of health that actually create the situations in which people end up bankrupt. An individual that is making $20 an hour makes $41,600 a year. If you're paying rent in Los Angeles, you already know that that's already a very minimal income, but you don't qualify for Medicare. You also don't qualify for the Bronze Covered California Care Package, which also has an $8,000 deductible, as I mentioned earlier. So all of these things, the way that we live our lives every day, have an impact on our health and have an impact in our well-being and our mental health. Because if all you're worried about, how am I going to pay my bills? How am I going to pay my rent? How am I going to, feed my family? All of that causes all the stress that builds up that you end up in the emergency room. So we should have a process in which people can have access to a doctor for preventative care versus reacting towards something that's already happening in their body.
Awesome.